Well, sit down. Yeah.
Okay, good afternoon, everyone. Thank you so much for joining us, and welcome to today's Medical School Partnership Teaching Site Residence Dedication and Open House. My name is Jerry Karen. I'm the Executive Vice President here at Franklin Community Health Network. And welcome and thank you for joining us. You know, it takes a team to bring to life a partnership. On the last page of your program, I do want to recognize and thank so many people who have teamed up to bring life to our partnership with Tufts, Maine Medical Center, and this building that medical students will call home. First, I'd like to acknowledge and give special thanks to the FCHN Board of Directors and the Finance Committee for their review, endorsement, and support of this strategic initiative. Special thanks to the administrative leadership of our network for their support in taking on another strategic initiative. Special thanks to the medical staff for their engagement and support, particularly Dr. Dixon, Dr. Gooch, Dr. Auger, and Dr. Goss. Finally, but certainly not least, I'd like to thank the plant operations staff, the environmental services staff, and the interior decorating team and the open house committee. Thank you all. This medical school partnership residence will serve as home away from home for future rural primary care physicians in training. Through teamwork and partnership, the future for rural primary care medicine is strengthened and a little bit brighter today. This is an appropriate time for me to segue to our keynote speaker, and that's Dr. Peter Bates, the academic dean for the Maine Medical Center, Tufts University School of Medicine. Would you please join me in welcoming Dr. Bates to the podium?
See if I can hold this correctly so you can hear me. Is it working? Well, it is a big moment for us. It's a big moment for Maine Medical Center and the Tufts University School of Medicine. I think to see our partnership come to fruition through the recognition, dedication of a residence like this for students is really a terrific time in the evolution of our medical education partnership. I was driving up today and thought back to February of 2008 when we sat down with the leadership of Tufts and codified our relationship. And after the usual ceremony, something like this, a guy came down out of the audience. It was Dave, who said, "This is a pretty good idea, and we really want to be part of this in Farmington." And I've known Dave off and on over the years as a previous friend of Maine Medical Center, and I think he educated partially at Maine Medical Center, and being involved in the Maine Practice Network, but to have him express from the outset the desire to have a highly recognized community hospital as part of this partnership was a big deal for us. And he's been encouraging and followed through ever since. And we knew from the very outset we wanted to have a strong community education partnership with these students. We look at medical students and the needs for physicians in rural Maine. We know that financial support during their education and a community-based education model, that is the opportunity to learn their craft with experienced physicians in communities like yours, is a big part of the success of the program. And to be truthful, early on we needed community hospitals who embraced and partnered with us in this vision to make it happen. And to have Franklin Memorial Hospital in your community step forward like that, to show us the beautiful facilities you have here, be willing to commit resources to develop a place for students to live, is really, as they say in the MasterCard land, priceless. I can't thank you enough for what you've done. You've given this program a kickstart. You've You've already welcomed students in your community, and it's trickling back to us and also to the leadership of us that this is an organization that cares about education and its future workforce and is willing to do what it takes to improve that workforce and make it worthwhile for the citizens of the community. Now, a little bit about our program, and then I won't blather on too long. Our relationship with Tufts is really a unique and kind of a signature education program. We've been an affiliate hospital with medical schools in the past, but we're now really a partner, and in turn, you and we are a partner in educating our future physician workforce. It really starts with the pipeline, if you will, engaging young people to be interested in health careers, and we hope that the students being in your facility and working with your staff will interest people in your community in health careers of all kinds, physicians, nurses, pharmacists. And it means providing access to medical education at an affordable cost, because we want the graduates of this program not to be saddled with debt that will prevent them from choosing a primary care career in communities like yours. And it also means getting an education in a community like Farmington, where students can work with experienced providers and see the values and virtues of living in a community like yours. All those dreams, all that vision, need partnerships like this, and your ability to join us is really of immeasurable value. So thank you from the bottom of our hearts. Thank you for facilitating this for the residents, and thank you for welcoming the students. Now, before I vacate, I want to introduce and recognize the people in our program that are actually doing the work. So it's great for me to show up and give a nice presentation and enjoy all this with you, but there are people here who really provide the education for students. I want to recognize them. The first is Kathy Cadigan. Dr. Cadigan is the director of HR. She's going to be one of the principal liaisons for your community site preceptors. Next is Bob Trowbridge. Dr. Trowbridge is the director of the first couple-year educational program, and finally, Bob Bignew, wherever you are, Bob. Dr. Bignew, Bob Bignew actually makes this all happen. So I have to recognize Bob, or he'll remind me later. Thank you again for having us. Thanks for your generosity. Thanks for your commitment to education. And we look forward to doing wonderful things together. It's going to be a great ride, and we look forward to every step of the way with you. Thanks very much.
It's my honor to introduce to you Diane Jackson, regional representative for Senator Snow, who has a special message for us on this day. Diane?
Good afternoon, everyone. It's a pleasure to be here. Thank you so much, Jerry, Becky, and Dr. Bates. It's my honor to be here on behalf of Senator Snow. She does send along her deepest regrets for not being able to be here. And I am going to explain to her firsthand that she needs to stop by, because this is going to be the house that all the medical students are going to be fighting for. You're going to be hard-pressed to keep them away. And I'm pleased, as I said, to deliver the Senator's message to you here today. Dear friends, thank you for the opportunity to join you as you celebrate Franklin Memorial Hospital's partnership with the Maine Medical Center Tufts University Medical School program, as well as today's residents' dedication and open house. If only Congress could follow your lead and collaborate so well. I couldn't be more pleased to share in this occasion with Rebecca Ryder, who has been such a tremendous leader of the Franklin Community Health Network. In fact, it was just last August that Becky took me on an exceptional tour during my site visit here. As Maine's emergency department use is 30% higher than the national average, I was especially grateful to meet the emergency room staff who worked tirelessly to meet the enormous demand for care. I was also impressed by the incredible strides you've made with the electronic intensive care unit, which leverages the expertise of critical care specialists and improves quality and patient outcomes. Unquestionably, hospitals as forward-thinking and cutting-edge and quality-driven as Franklin Memorial are indispensable to a state like ours that is predominantly rural, not only for your world-class medical attention, but also for the training opportunities you offer, like the one you are recognizing today.